So how many of you here have been taken care of by a nurse or know someone that's been taken care of by a nurse, whether it's been in the hospital, the doctor's office, or a nursing home? Okay, so most of us here have most likely been taken care of by a nurse or know someone that's been taken care of by a nurse. And whether that's been at the hospital or the doctor's office or a nursing home, the nurse is pretty much the first person we see before we see a doctor. And is it important to understand that although there may seem like there's an abundant supply of nurses, there may be a possible shortage in the future. As a nursing major, I've had the privilege to work in the hospital and the nursing home, and I believe I am capable to talk about this topic. I have also done extensive research on this topic to help support my claims, and was saying that nursing shortages will increase over time in the United States, and the main factors that I will be talking about that will affect this are the growing and aging population, healthcare availability to more people, and immigration law changes. I will first discuss how the growing and aging population will affect the shortage of nurses in the United States. According to the United States Bureau of Census in 2019, the population growth rate has increased 6% since 2010. Although that may not seem like a large number, that still shows that the population is continuing to grow over the years and will continue to. And according to the U.S. Department of Health and Human Services in 2017, it states that many states will have a shortage of nurses. Specifically, California will have a shortage of 44,500 nurses, Texas will have a shortage of 15,900 nurses, New Jersey will have a shortage of 11,400 nurses, and South Carolina will have a shortage of 10,400 nurses. And in an article by Grant in 2016, within the growing population are aging baby boomers, and she states that there will be more baby boomers over the age of 65 than any other time in American history. This means that the baby boomers will seek more medical attention. And in this slide, you can see that since the 1900s, the number of baby boomers has increased over time and over the years. My parents are actually part of the baby boomer generation, and I have noticed that they do have more frequent doctor visits just because they are getting older. As statistics and reports have stated, the growing and aging population are factors in relation to the demand for nurses, and not only are those factors, but healthcare availability to more people and immigration law changes are as well. So as nurses, we are committed to taking care of our patients, and according to an article in 2018 by Carnival, the nurse's responsibilities on a daily shift consist of taking care of patient needs. They also document the care that they've given, they coordinate care, and they advocate for the patient. And in this slide, it pretty much kind of shows what a nurse does for each patient. So first they assess the patient to see what's wrong with them and what they need to do. Then they make a plan of care. They look at the doctor's orders and try to make a plan to figure it all out. Then they implement the care, so they start treating the patient, they do tests if they need to, and then finally they evaluate, which is where they see if their plan of care was a success or not. So as you can see, the nurse's responsibilities for each patient are a lot. And according to McConville in 2015, not only has the Affordable Care Act made healthcare available to the poor and uninsured, California passed a new law that has extended their healthcare coverage to undocumented immigrants. So not only will this increase the workload for nurses, but the healthcare team as well. Also, in an article by Carnival in 2015, the international nurses that the U.S. brought in to help with this shortage of nurses is no longer available due to the working visa law changes. So that is kind of a struggle as well. And also in an article by the U.S. Representative Suzanne Bonamici in 2018, thankfully they have passed a bill that addresses the problem of the shortage of nurses. And hopefully in the near future they will plan to make a change in this. And in conclusion, we have seen that there are many factors that affect that will affect the shortage of nurses over time. And we're saying that nursing shortages will increase over time in the United States. Not only will the growing and aging population affect this, but healthcare availability to more people and immigration law changes will affect this as well. And we all expect to be given the best care possible, whether it's at the hospital, the doctor's office, or a nursing home. However, with possible nursing shortages in the years ahead, hopefully, through the hard work of the nurses and the healthcare team, whether there's a high supply or a short supply, they will continue to give care to all people with open arms and with the best care possible.